Okay. Go ahead.
My name is David Moody, and I give consent for Diane Moody to give me a physical on today, September 9th, 2017.
So, of course, you always want to wash your hands before you do any type of exam. And so today I'm going to be doing a head, ear, eye, nose, and throat exam on Mr. Moody. And so Mr. Moody is obviously awake and alert. And what is today's date?
September 9th,
You already
2017.
Okay, so I'm going to begin by examining your head. And first of all, are you having any kind of pain today?
No, ma'am.
Okay, so today we're going to be focusing on your head, ear, eyes, nose, and throat. So most of the questions will pertain to that, and then we'll also do a skin exam. So I'm going to start with the skin exam real quick, and then we'll move to your head. So do you have any skin issues that you are aware of right now?
No.
Okay, so Mr. Moody's skin is warm and dry, and obviously he's out in the sun quite a bit. Do you use sunscreen?
Yes.
Okay, and I would check his turgor, which is adequate. His skin does respond back down quickly. I don't notice any open areas. There's no swelling of his hands. There's no clubbing of his fingers. His nails are well manicured with a little bit of picking noted. He does have adequate cap refill. His nail beds are pale pink, and there's no cupping of his nails, no cuticle irritation. The perineum is intact with no swelling noted. He does have a normal hair pattern on his arms. On his legs, I don't notice any open areas. They are dry. He does have a little bit of decreased hair pattern on his lower extremities. So Mr. Moody does have sunspots, and he does have multiple dark pigmented moles. Do you see a dermatologist regularly?
Yes, I do.
You do. And you know to watch for any moles that have a change in color, irregular shape, if they're raised, or if they become irritated, and it sounds like you already do that. Okay, he does have some scars, and you have had some moles removed before, correct?
Yes.
Okay, so now I'm going to check your head, and any tenderness when I palpate?
No, ma'am.
His head is symmetrical. He does have some male pattern baldness noted. He does have one scar in his head, and was that from an injury? It looks like you had stitches.
I don't remember.
Okay, and then I'm going to move and check your sinuses. If you'll look at me. So, is this tender?
No.
Okay, these are the frontal sinuses. Maxillary sinuses. Any tenderness?
No, ma'am.
Okay, and then can you open and close your mouth? Is that painful at all?
Not at all.
Okay. So I'm going to note that his eyebrows are symmetrical. Nose is midline. No problems. Then I'm going to move to his ears, and the auricles are intact with no redness, no nodules noted. Okay, I'm going to whisper something, and I want you to tell me what it is, okay?
Saturday. Cat.
Okay, very good. Any hearing problems that you're aware of?
No, ma'am.
Okay, I'm going to examine your ear and turn you ever so slightly, and if you have any pain with this, just let me know. I am going to pull your ear up a little bit so I can visualize. And I am able to visualize the tympanic membrane, which is pearly white. Looks good. There's no bulging, no redness. I do see the bony prominence of the malleus in the upper quadrant. And I do note cilia and very little wax in his ear. So for the other ear, making sure the camera's good. Same, very small amount of wax. I do see a very shiny tympanic membrane. And I do see the cone of light in the bottom quadrant there. So no problems with that. Okay, now I'm going to examine your nose. And so you tell me if this is uncomfortable at all. His septum appears midline. Just going to gently raise. So the tissue is pink. Cilia is present. Tilt back just a little bit. I can visualize the turbinates. They're not swollen or irritated, and the inside of his nose is pink and moist. And so no problems noted there. So next I'm going to ask you to focus on, well, first of all, I want to examine your eyes. And so I just want you to look straight ahead. So his eyelashes are intact. I am going to check your conjunctiva are pink, moist, with no irritation noted. Can you just gently close your eyes and let me feel your eyelids? No masses, nodules, no redness noted. And the sclera appear to be clear. So I'm going to get you to focus on that spot on the wall. And now I'm just going to get you to follow the tip of this light, okay? And I don't want you to move your head, just your eyes, okay? Don't move your head. I don't note any nystagmus when we move side to side, and he does appropriately follow my light. So I'm also going to just check his pupils. Just look, continue to look at the place on the wall. His pupils are reactive to light and they contract appropriately. Both lights are reactive to accommodation also. So Mr. Moody, I'm going to actually examine your eyes now. If this is uncomfortable at all, you can let me know. But first I am going to check for the red reflex. And it is present. And then I'm going to do a closer exam. And I do note the red reflex there. I can see the outline of the optic disc. And I am able to see the optic disc, and in his left eye I was able to visualize the blood vessels there. So no issues with your eyes. Okay, so next I'm going to examine your mouth. And so as you look at me, I see that your mouth is symmetrical. Can you smile? Okay, so if it can get you to open wide, I'm just going to look at your teeth. I'll tell you if I'm going to touch. And okay, I'm going to move your tongue over to the side. And I don't visualize any ulcers, no discoloration. Open wide, let me see your palate. Lift your tongue. And stick your tongue out at me. Okay, now I am going to touch. And you can put it back a minute. I'm going to examine the back of your throat, and I am going to touch back there. And so it's probably going to gag you just a little bit, okay? Say ah. Ah. Okay. So his uvula is midline, his tongue is midline. I don't appreciate any ulcers, redness, swelling, and obviously he has a dramatic gag reflex. So now I'm going to move down and examine your neck. Can you turn your head side to side for me? No problems with your neck?
No.
Okay, and so first of all, I'm going to feel your lymph nodes, okay? And while I'm doing this, you tell me if you experience any discomfort or pain. So I'm going to start in the back with the occipital nodes. Then I'm going to move to post-auricular. I'll palpate lightly and then more firmly as I go. Pre-auricular. Any discomfort?
No, ma'am.
Parotid. Submandibular. And then submental. Then I'm going to move down into the neck to the anterior cervical. No problem.
Nope.
Posterior cervical is in that groove behind the muscle there. And then posterior cervical. It's a little bit deeper. No problems?
No, ma'am.
Supraclavicular. Okay, now I am going to examine your thyroid. So what I'm going to do is just palpate first, and then I'm going to have you get a sip of water so I can observe, okay? Well, let's do that first. Go ahead and get a sip of water. Hold it in your mouth, and I'll tell you when to swallow. Okay, go ahead and swallow. Okay, I watched the cricoid shift right there. And now I'm going to gently, okay, just relax. Okay, I'm going to shift with my fingers, and I can see the edges of the thyroid and palpate it. I do not feel any nodules. To me, it seems a little bit larger. I can see it shift, actually. I don't appreciate any nodules. Is that tender?
No, ma'am.
So that might be something I have him discuss with his physician at his next visit. Okay. This concludes our physical today. Thank you.